The rules apply to everyone, Australian, non-Australian. If they have their feet on Australian soil, they will be expected to adopt the rules, and if there are breaches, then there is no question that the authorities will take them up with their home country, and they will take them up very, very strongly.
Should MPs returning to Canberra this weekend for that protest over the weekend? Should they be returning to Canberra? Should they be going back to Parliament?
Well, I'll leave that up to them individually. What Dr. Nick Coatsworth has said on behalf of the medical expert panel today is that anyone who was at these protests should self-monitor. If there are any symptoms, they must immediately be tested and self-isolate.
Are you comfortable sharing Parliament with MPs for the protests over the weekend?
Well, I would say this. The medical expert panel advice, the advice of every chief health officer in the country, was absolutely clear that these gatherings, for the most noble of causes, absolutely for the most noble of causes, these gatherings, like any gathering, were a potential health risk. And as I said on Friday, it was a lottery. We don't know whether somebody who's infectious was present, and we will find out in due course as to whether or not case numbers grow. But this isn't about the cause, the most noble of causes and the most understandable. It's about the health protection of Australians, and our message was very clear, and individuals, particularly elected officials who breach the health advice, will have to explain why they breached that health advice.
Minister, just quickly, you touched on headspace being important for when we transition out of COVID-19, but how difficult will it be for the government to transition Australia out of JobSeeker and JobKeeper?
Look, we're on a journey as a country. We've been through an unprecedented time where there's been a global health crisis and a global economic crisis. Australia is at the head of the pack in responding to both of those crises in terms of our health outcomes. Now, health outcomes have allowed us to seek to return to a better normal as quickly as possible. The fact that we are able to lift some of the restrictions, that we are able to lift some of the supports, then these are causes for real hope and real optimism going forward. So what we want to do is to get Australians back to what we call a better normal, recognising that we've had extraordinary success. We still need to be vigilant, but with each day we're making progress on the health front, and with each day that means we can make progress on the economic front. Look, Australia is working closely with New Zealand. Both countries are being cautious and taking their time. Both countries have been very successful, and so I would say this, that over the course of the coming period, and I won't put a time frame, we are working closely with New Zealand. We'll continue to work closely with New Zealand. We've both been successful and saved lives and protected lives, and when the time is right, then we may well be able to have travel between the states in Australia and between Australia and New Zealand, and that's, I think, a very positive thing.
One of the biggest barriers in young people accessing is cost. Many young people say that once they've used their subsidised sessions, they can no longer afford to access mental health services. Would you consider increasing that?
So there's another medical expert process going on, and that's what's called the Medicare Task Force. The Medicare Task Force is currently reviewing psychological services, and will be guided by their advice as well. That hasn't finished, and so one of the things that they're considering is MBS and the Better Access Scheme. So we'll await that carefully and respond to that positively once that's complete. Well, we're always adding new services, and today is about adding new services, and today is about adding free support and free services. That's one of the hallmarks of Headspace, and so we have Headspace, we have the work of Beyond Blue, we have our Medicare supports, we've had telehealth, for general GP services as well as psychological and psychiatric services. We're now at over 13.8 million telehealth services in Australia, and a very large percentage of those have been for mental health services, and they've provided access to Australians, and we're looking to keep telehealth on a permanent basis going forward, so that will add to the access. Then I think I will turn now to Richard.
Thank you very much, Minister. Have you received any updated advice from the AHPPC on the easing of restrictions of the timetable? And considering the whole infection rates, the strong border measures, is there any chance that Australian businesses and people who be doing basically the right thing might get to see restrictions lifted earlier than we previously planned?
Yeah. So the medical expert panel, or the AHPPC, will be providing advice to the National Cabinet in advance of Friday. They're going through the considerations in the course of this week, and if there is continued progress in flattening the curve, then there's the potential to increase the actions and decrease the restrictions. So I am hopeful that over the course of this week we'll continue to see progress, and each week that goes by with reduced numbers and a greater flattening of the curve, there's increased potential for, across a range of different activities, reduced restrictions and increased activity. And I think that that's very positive. Friday's the day when the National Cabinet will be considering the advice that the medical expert panel is collating this very week.